I'm now going to hand over to Penny. Penny is the Q Initiative Director and the Interim Director of Improvement at the Health Foundation, who's going to speak to us about the two worlds of improvement in digital and how we can maximise our opportunities. Over to you, Penny.
Wonderful, thank you. It's a real pleasure to have 15 minutes now to kind of step back, think about how bringing together the worlds of improvement in digital can boost all of our work. So I'm going to speak for around 10 minutes, leaving 5 minutes to hear your thoughts and answer any questions. Next slide. I'll be sharing kind of insights from Q. I'm sure there'll be plenty of Q members here, but for those who haven't come across it, Q is an initiative of over 4,500 people from all sorts of different backgrounds who are coming together to share, learn and collaborate as they work to improve health and care in the UK and Ireland. Next slide. So during the pandemic, we surveyed over 200 Q members and we asked them what they thought the top priorities for the improvement world were, given the learning that we've had from the pandemic. Introducing kind of digital innovations effectively came out in the top 2 responses. So I guess there's lots of appetite in the improvement world for engaging better with digital, and I think a sense amongst those of us who carry a kind of improvement toolkit around of what improvement methods and approaches can offer. I think as Breed captures here in this great quote, it's quite hard to think of a service improvement work without a digital element at the moment. And likewise, hard to think of digital implementation work that couldn't have its own prospects for success enhanced through improvement. And yet, we're currently often operating separately. So I guess Q is here as a kind of cross-sector, cross-discipline community that tries to boost the reach and impact of other networks. When we see a silo that's holding us back, we try and support the community to get on in there and reach across divides. Next slide, please. So I'm going to draw mainly on 3 areas of work in this presentation. So during the pandemic, we followed 50 people implementing video consultations and distilled what they learned into blogs and this infographic. Since the autumn, our Q Lab has been working on a project looking at how to boost the trust and confidence of patients and staff in tech-enabled remote monitoring. And our funding programme, Q Exchange, has seen many projects with collaboration across digital and improvement come through. Our latest round that's just been launched will be focusing squarely on this, and I'll say a little bit more about that in a bit. Next slide. So in a slide, what does an improvement lens bring into focus when it comes to digital change work, and how can improvement mindsets and methods support success? I've drawn out 4 core processes where I think improvement can help. Just before I get into that, let me just say a few words about what's in the centre there. Next slide. So I've chosen the words fast, credible and sustainable carefully, and I mean them here as I think improvers typically will, in a very people-centred way. So the Q Lab project focuses on what will build staff and patient confidence in tech-enabled remote monitoring, because the level of confidence a project attracts, I think, is a pretty good leading indicator of whether digital solutions are on track. And you'll all know that without the people using and delivering services being involved on side, progress is rarely fast. And even if things are implemented quickly, the seams start to show and service solutions are rarely sustainable. So the change you're proposing being credible is key. But I guess securing staff and patient confidence is far from straightforward. The images here are just a selection from kind of sense-making stage of the current Q Lab project, looking at the map of different factors that influence confidence. The factors individually, I'm sure, will be familiar to you, like strategic alignment, issue of workload, confidence in the reliability of the tech, and attitudes to data security and risk, as Vin was touching on. It's familiar from the panel conversation. And yet I reflect we rarely have the time to think about how these different factors interact and what it would actually take to address them systematically. So while some of what's being learned through this Q Lab project will be specific to tech-enabled remote monitoring, much may well apply to other changes that you could be involved in. So please do kind of follow the work to learn more. The team is kind of sharing as they go through design into testing and practice through the spring. Next slide, please. So we know there's lots involved in the kind of process of change in human systems, but in a few minutes that we have here, I've had a go at drawing out 4 things that I think can help if you want to more reliably get to what you're trying to achieve. So this is based on what we're seeing from the many projects with a digital element that have surfaced through Q, and builds on the Health Foundation's long heritage of learning about improvement. So aligning to organisation and system priorities. It's something that we know is necessary if service improvement or technology projects are to get the support that they need. An improvement lens can help take a system view, making sure that the benefits of the technology are understood in a way that's embedded in a wider view of services and needs, rather than the technology becoming maybe a bit too centre stage in how you're describing it. I think this perspective helps make projects credible for decision makers and all the many people who will typically then need to contribute or change for technology to work in practice. The skills of meaningful co-design and collaboration are then needed to follow through on that kind of shared priority. So whether that's involving service users and carers in design of services, mapping supporting processes with those who are going to actually be doing the work. I think improvers can help make sure that projects are really grounded by the perspectives of those who will be delivering and receiving the services in practice. The ethos of improvement, of like rapid testing and adaptation, I think that connects really well with the user-centered design approaches that I know are really well established in the digital world, a kind of helpful counterbalance to some of that overly drawn out approach to introducing IT systems in a big bang way that, you know, I think we've learned carries a kind of high risk of failure. Ultimately, the successful delivery of the projects that you're involved in need a kind of whole range of skills, from information governance and project management, role design, process mapping, change management, like much, much more. Complex change needs what they're kind of calling in Scotland a multidisciplinary transformation team. I think improvers can both bring some of the inputs a digital change project team needs and can often bring tools and experience with making the most of different skills and perspectives so that the team as a whole functions well. Certainly in Q, we're finding that these skills of enabling effective collaboration are as kind of central to improvement work as any of the more classic capacity and demand, process mapping or measurement skills that you might associate with improvement science. Next slide, please. So we've learned that, the next, yeah, thank you. I guess, you know, we've picked up that effective teamwork and collaboration, it doesn't just happen. Often the expertise and the hard work involved is under-recognised in the health system. In Q, we've responded with quite a few tools that you might find helpful, from kind of quick processes you can use to make your discussions more genuinely inclusive of the perspectives that you need, to a kind of deeper analysis of the skills and mindsets that are required for collaborative change to be effective. So this map was developed with Nesta as a set of practical exercises that you can use to help pay attention to how you need to work together. Just as the technology is only part of the service change we want to see, so the process of implementing change is, as they say in improvement circles, 20% about the technical aspects of change and 80% human. That doesn't mean that the human bits are kind of simply intuitive or left to chance. It's just that you need to have approaches and skills on your project team that draw on which are kind of appropriately people-centred, and recognise that it's often those people sides of change that will make or break it. Next slide, please. So often it can be quite difficult to get dedicated resources for those kind of people, processes, aspects of change, or for projects that allow us to think more broadly about the change we're trying to achieve, with kind of mechanisms for learning over time and between places. Q Exchange, which is the participatory funding programme that we run in Q, that's here to complement some of the other offers that are out there. So this year, jointly funded by the Health Foundation and the NHS in partnership for digital health and care. It's all about this theme of bringing together the worlds and methods of improvement and digital. The process is designed to be developmental, help people use their time well, collaborating with others, drawing in ideas from elsewhere. So you can be confident that your project is building on what others know and have already done. We expect to make 40k awards to 20 teams, and those will be selected by the Q community through an online vote. These awards may be relatively small compared to some of the other offers out there in the digital space. However, this funding can be used to bolster existing programmes of work, can be spent on the change process, not just the tech. For example, helping to boost the design or evaluation activity that you're doing, so that we're kind of investing in sustainability, sharing and scaling in a way that I know can be really hard for people to prioritise otherwise. We're also inviting bids here that are about building kind of links and understanding between those working in improvement and digital. So I guess I'm hoping that you, as leaders of digital innovation, might have ideas that you think could be contenders for funding and could get in touch with Q members in your area if you're not already one, to seed some proposals. And that you might get involved in the process as ideas are shared, so that we can make the most of what you know to shape upcoming projects, because you never know what you might kind of pick up in that process. Okay, next slide. Okay, so that's where I wanted to end, with a kind of practical opportunity for us to build on the things that we're talking about today, whether that's Q Exchange, the Q lab work and resources, or making links with the people and other work in Q. I do hope that you might find something there that's useful to the amazing work that you're doing. And if you haven't joined yet, you might want to consider it. So yeah, very happy to answer any questions. Love to hear your thoughts or any connections this has sparked for you.
Great, thanks, Penny. You know, I always get excited about when people are talking about the worlds of digital and improvement, because I just think they need to be as one. A couple of things. Somebody's popped a question in the chat, but they've used the acronym FDI, which I have to say I don't know. So perhaps if that person could just write what FDI means, but it says, can Q Exchange support FDI to gather the evidence and work with the NHS? So we'll wait for that. But question from me, if my advice to people would be go and find your Q member in your local system, but actually if people on this call who don't know about Q and you've now enlightened them, how would they find out about who their local Q member is?
So there is a publicly searchable directory on the Q website. I can see my colleagues from the Q team have been posting some stuff in the chat, so I'm sure they'll do that shortly. Yeah. You can search by organisation, by name, by HSN area. So yeah, please do kind of take a browse, have a look, see who's around, and you'll see a load of people from all sorts of different backgrounds there. So I tend to think it's a good inspiration to have a chat to somebody, and then you never know, you might find it's also for you.
Yes, and I think it is about you know, going and having a coffee with your improvement colleague, because they'll have a different perspective. And actually what improvement people tell me is actually they'd like more interaction and real conversation with their digital colleagues. So I think there's a real opportunity here. I'm just trying to check if the acronym has been foreign direct investment. So I'm glad it wasn't one I've come across before, because I thought, so I think we might have to take that one offline, but we will respond to that. Any other questions for Penny? This question of how can we join Q, but I think your team have been very responsive. I mean,
I love your emphasis on just go and have a chat and have a coffee. I mean, I'm conscious, you know, Tim starts the day with this big vision for joining up innovation, improvement and digital stuff. I mean, that is going to happen through individual relationships and conversations and sense making. So I think we're really here to just try and help with some of those connections.
Exactly, and I think it's you know, what's happened in previous events, this is our fourth event, is people have made connections across the country, across their own projects, but perhaps we also need to help people to know who locally that might be able to help, because I'm often amazed about the people don't know who might be able to help locally. So yes, do look up that Q community list, and for any Q members on here, do make sure you're having a chat to your digital counterparts. I don't think there's any further questions, Penny, and I think that's because your team have been posting so much that all the information is on there, which is great. So thank you very much. And hopefully
just one question I saw come in, which might be worth picking up and answering. Yes, Q is open to people working in anywhere in the health sector. So we have a lot of patient leaders who are Q members. clinicians, managers, people working in social care. It really is open to anybody from different backgrounds who's got some kind of experience in a systematic approach to making health or care better.
And also the care sector, because we'll probably have a lot of care sector colleagues. So great, wonderful. Thank you very much. We're now going to go for till 10:10, thereabouts, for a quick break to stretch your legs and grab a brew, and then Laura will be taking us through the second part of the session, so do stay with us. But go ahead, top up your teacups, and we'll see you at 10 past. Thank you.